Pediatric condition falsification. National Children's Alliance estimation of children abused or neglected in the United States in 2012 was 686,000. Of the cases reported in Utah, less than 8,500 were substantiated. The Washington County School District identifies child abuse or neglect as causing harm or threatened harm to a child's health or welfare. There appears to be limited studies and statistical information on a type of child abuse that is falsified or unsubstantiated. Are you familiar with these? It goes by many names. So what's in a name? Karl Friedrich Hieronymus Freier von Munchhausen was a German nobleman who during the 18th century joined the Russian military and fought 2 campaigns against the Ottoman Turks. Upon his return, he became famous for telling his exaggerated tales of being a soldier, hunter, and sportsman. Since the exaggerated tales of Baron Munchausen, the medical profession has used his name to describe a person who exaggerates or makes up an illness or injury. The illness belongs to a group of mental illnesses called factitious disorders. Richard Asher was the first to describe Munchausen syndrome as a psychiatric disorder in 1951. Pediatric condition falsification is described as a condition in which the caregiver underhandedly injures the child or the child's symptoms were fabricated, both leading to unnecessary or potentially harmful medical care. A study titled Factitious Disorders and Munchausen Syndrome, the Tip of the Iceberg, was specifically conducted to evaluate the prevalence of pediatric condition falsification. The study took place over a 3-year period and consisted of 751 patients, 14 of whom were diagnosed with the syndrome. The perpetrator was the mother in the majority of the cases. This is baby Brewington. His mother had taken him to visit several hospitals in Tennessee with undocumented diseases including unexplained seizures and brain damage concerns, yet was never satisfied with the diagnoses of the doctors and insisted on further testing. In 2010, Amber Brewington of Tennessee pled guilty to the charges that she injected her infant son's feeding tube with high levels of salt water. A psychiatrist testified that Brewington suffered from Munchausen by proxy syndrome and that she suffers from a borderline personality disorder and suicidal thoughts. She was sentenced to 5 to 15 years in prison for the aggravated assault and endangering the welfare of a child. In 2011, a team of multidisciplinary physicians were presented with a case in which a 16-year-old female was complaining of unexplained bleeding from multiple and unusual sites, all of which had been witnessed only by her mother. After numerous costly, extensive, and invasive exams, the team had concluded that no abnormal findings had been presented. However, they did find self-induced injuries throughout the patient's hospital stay. The physicians identified the patient as having Munchausen by proxy, although she was only 16 years of age. A child of this age will often try to assist in meeting the parent's need for attention. In 2012, a 38-year-old female had taken her 3 children ages 5, 8, and 11 to various area hospitals to investigate blistering on the nose and cheeks that resulted in scarring. Munchausen by proxy was eventually confirmed when the mother confided that she had been using hydrochloric acid on the children's faces. In 2013, there was a case in which there was a foamy discharge on the scalp of a 10-month-old infant male. The 22-year-old mother originally presented the condition to her physician, who later referred the case to a medical college for diagnosis. Upon examination, a foamy liquid would reappear on the frontal lobe of the infant 15 to 20 minutes after wiping the area. The physicians noted that the mother was unwilling to leave her infant son at any time, and examination of the foamy discharge under a microscope showed no signs of living cells. The young mother eventually admitted she was using shampoo to fabricate the foamy discharge in an attempt to avoid doing work and stay with her child, who was thought to be ill. In 2014, an article titled "Caretaker Blogs in Caregiver Fabricated Illness in a Child" revealed 3 cases from Seattle, Washington, in which mothers were doing online blogging about the illnesses of their children. There were common themes about these blogs. First, there was a distortion of the information parents had received from the physicians. Second, there was an exaggeration as well as escalation of the illnesses presented. And finally, the mothers were contacting organizations for donations to help pay for their child's medical needs. Protective services and investigators were able to use internet blogs as well as medical records to assist in diagnosing pediatric condition falsification. This disorder is emerging itself into the educational setting for which parents are seeking out extensive evaluations for children who do not demonstrate the educational needs. Districts are being asked to test students who don't have disabilities under the Individuals with Disabilities Education Act. Unfortunately, special education directors are weighing the costs of the evaluations against the cost of defending themselves in litigation to prove the evaluations are unnecessary. Some of the warning signs of the child or victim are unusual illnesses that cannot be proven. The child appears too healthy to fit the medical history, treatment failures, illnesses that are only witnessed by the caregiver or has an absent or emotional distant father, and there are attendance issues at school. Some of the warning signs of the mother or caregiver are that they are caring, concerned, intelligent, articulate, medically knowledgeable, comfortable in medical settings, consistently pushing for further testing, procedures, surgeries, and appointments, and may become aggressive and hostile when dissatisfied with results. Field interviews were conducted regarding pediatric condition falsification or Munchhausen syndrome by proxy. Some of the comments received were that the child had overwhelming number of absences that were sick-related. Parent identifying the child as having medical emergencies, although no occurrences were ever within the schools. Behavior issues escalated whenever the mother was present, and conversations with the mother revolved around details of debilitating illnesses, treatments, or physician's visits. Most of the comments received had to do with the mother. The Child Welfare Administrator interview came with different results. She knew of 3 cases, and only 2 were supported with evidence in her 14 years of service. She was concerned about a lack of reporting of cases and believed that pediatric condition falsification is not taken seriously when it's reported by educators as opposed to being reported by physicians. She had a much greater concern for the overall numbers of abused children and wanted to make sure that Child Protective Services is known for being there for the child regardless of the type of abuse. It is the policy of the Washington County School District Board of Education that any school employee who, in the course of the duties as an employee, knows or has reason to believe that a child's health or welfare has been or appears to have been harmed as a result of sexual or physical abuse or neglect, or who observes a child being subjected to conditions or circumstances which would reasonably result in sexual abuse, physical abuse, or neglect, shall report or cause reports to be made in accordance with the law, policies, and rules and procedures of the district. In conclusion, statistics regarding pediatric condition falsification are relatively small in comparison to other forms of abuse. Healthcare professionals are the child's first line of defense. Physicians need to consider pediatric condition falsification as a diagnosis when there are discrepancies in a child's illness presentation. The fear of referral needs to be eliminated. Educators are child advocates. They have close and rather consistent contact with students and have a legal obligation to report cases of abuse and neglect. Children have difficulty focusing their attention on learning when they are being maltreated at home. There is currently a paradigm shift in the way child abuse investigations are being handled by Child Protective Services. There is a move to provide in-home services to families rather than remove children from their homes. All forms of child abuse are placed into 3 categories: neglect, physical abuse, and sexual abuse. There is limited knowledge of pediatric condition falsification because the symptoms are so difficult to diagnose. There is a great concern in the realization that referrals of child abuse are increasing yearly, with only a portion of these cases being investigated and substantiated. It is the legal obligation and responsibility of educators to be knowledgeable in cases of child abuse and neglect and report them accordingly. Attached are 2 links to videos regarding pediatric condition falsification, or better known as Munchausen syndrome by proxy.